Did you know that every 40 seconds someone in the US experiences a stroke? For seniors, this risk is significantly elevated, making awareness absolutely critical. But here's the truly shocking part. What you do in the first 3 minutes after symptoms appear can profoundly impact brain function, mobility, and even survival. Stay tuned, because today, we're revealing a simple, yet powerful 3-minute strategy every senior, caregiver, and healthcare professional should know before emergency help arrives. This isn't just about recognizing a medical emergency. It's about empowering you with immediate, actionable steps. Welcome back to Everbright Seniors, your trusted resource for vital health insights. In this comprehensive guide, we will walk you through how to recognize the subtle and overt signs of a stroke instantly, the critical 3-minute actions you can take to potentially mitigate damage while awaiting emergency medical services, and essential long-term strategies to significantly lower your stroke risk, promoting a healthier, more vibrant life. So, grab a notepad and prepare to absorb information that could be among the most important you ever learn. This knowledge empowers you to protect yourself and your loved ones. A stroke, often referred to as a brain attack, occurs when the blood supply to part of your brain is interrupted or severely reduced. This can happen in two primary ways. Either a blood vessel carrying oxygen and nutrients to the brain becomes blocked, ischemic stroke, or a blood vessel in the brain ruptures and bleeds, hemorrhagic stroke. Both scenarios are medical emergencies. When brain cells are deprived of oxygen and vital nutrients, they begin to die within minutes. This rapid cellular death is why time is so critically important during a stroke. The longer the brain goes without adequate blood flow, the more extensive and irreversible the damage can become. Here's the sobering truth that underscores the urgency. Every minute during an ischemic stroke, your brain loses approximately 1.9 million neurons, 14 billion synapses, and 7.5 miles of myelinated fibers. This translates to an accelerated aging of 3.6 years for every hour treatment is delayed. The consequences of this cellular loss can be devastating, leading to permanent paralysis, severe speech impediments, memory loss, or profound cognitive impairment. Recognizing a stroke early and acting immediately is not just beneficial, it is absolutely paramount. Prompt medical intervention can significantly reduce the severity of brain damage and improve the chances of a meaningful recovery. This awareness is a powerful tool in your health arsenal. The ability to quickly identify stroke symptoms is a cornerstone of effective stroke management. The American Stroke Association developed the FAST acronym as an easy-to-remember tool for the public, caregivers, and even healthcare professionals to rapidly assess potential stroke victims. This simple test can be performed in moments and could be the difference between life and debilitating disability. If you suspect someone, or even yourself, might be experiencing a stroke, remember and apply the FAST method without hesitation. It is a straightforward, yet incredibly powerful diagnostic aid. F. Face drooping. Ask the person to smile. Observe carefully. Does one side of their face droop or feel numb? Is their smile uneven? Facial asymmetry is a classic and often noticeable warning sign. H. Arm weakness. Ask the person to raise both arms straight out in front of them, palms up, for about 10 seconds. Does one arm drift downward or feel weaker than the other? Inability to hold an arm up is a strong indicator of neurological compromise. S. Speech difficulty. Ask the person to repeat a simple phrase, such as, "The sky is blue." Listen intently. Is their speech slurred, garbled, or strange? Do they struggle to find words or understand what you are saying? Any difficulty with articulation or comprehension warrants immediate concern. T. Time to call emergency services. If you observe any of these signs, even if they seem to improve or disappear, it is absolutely critical to call 911 or your local emergency number immediately. Do not wait to see if symptoms resolve. Every second counts in preserving brain function. Provide the dispatcher with clear information about the symptoms and when they started. This simple 4-step assessment empowers you to act decisively. Healthcare professionals often use similar rapid assessment tools, and your quick observation can provide invaluable information to first responders. While waiting for emergency medical services to arrive, there are specific, evidence-informed actions you can take. These steps, often overlooked, are designed to potentially reduce further damage and improve recovery chances. This isn't a cure, but a crucial bridge to professional medical care. This controlled self-stimulation technique focuses on maintaining vital functions and minimizing secondary complications during those critical initial minutes. It's about optimizing the body's state until definitive treatment can be administered. The immediate reaction to a medical emergency can be panic, but maintaining composure is vital. If you are experiencing symptoms or assisting someone, ensure a calm environment. Avoid lying down flat, as this can increase intracranial pressure, especially in cases of hemorrhagic stroke, or potentially worsen blood flow dynamics. Instead, gently guide the individual to a seated, upright position. This posture helps reduce pressure on the brain and promotes more even blood flow, which can be beneficial. If dizziness is present, lean slightly forward, but ensure the head does not drop too low, maintaining an open airway. This position also makes it easier for paramedics to assess and transport the individual. This simple physical action can be surprisingly beneficial. Gently clench and release the hand on the side of the body that still has strength and sensation. Perform this action about 10 times in a slow, deliberate rhythm. This isn't about strenuous exercise. It's about gentle, focused movement. This rhythmic hand clenching helps to maintain peripheral circulation and engages the nervous system. While not a direct treatment, studies suggest that simple, focused movements during the early minutes of a stroke may help to stimulate alternate brain pathways and maintain some level of neural activity, potentially reducing the total brain cell loss. It's a subtle way to keep the brain engaged and blood flowing. Controlled breathing is a powerful tool for physiological regulation. Close your eyes, if comfortable, and focus on a deep, slow breathing pattern. This technique helps to manage stress, regulate blood pressure, and ensure optimal oxygen delivery to the brain. Follow this cycle for approximately 3 minutes. Inhale slowly for 4 seconds. Focus on filling your lungs completely. Hold your breath for 2 seconds, a brief pause to allow oxygen exchange. Exhale slowly for 6 seconds. Release the breath completely, emptying your lungs. Repeat this pattern consistently. Slow, diaphragmatic breathing helps to activate the parasympathetic nervous system, reducing the body's stress response. This, in turn, can help regulate blood pressure, maintain consistent oxygen levels, and minimize the release of stress hormones that can exacerbate stroke effects. These small, deliberate actions buy precious time until professional medical help arrives, potentially making a life-changing difference. While immediate action during a stroke is crucial, the best strategy is always prevention. Adopting healthy lifestyle habits can significantly reduce your risk of stroke, especially as you age. These daily choices are powerful investments in your long-term brain health and overall well-being. Here are 4 essential daily habits that keep your brain strong and your arteries clear. Recommended for seniors and emphasized by healthcare professionals. Move every day. Regular physical activity is a cornerstone of stroke prevention. Even moderate exercise like a brisk 20-minute walk can dramatically boost circulation, strengthen your heart, and help manage weight and blood pressure. Aim for at least 150 minutes of moderate intensity exercise per week, incorporating activities you enjoy to ensure consistency. Hydrate well. Dehydration is a common issue among seniors and can have serious implications. Insufficient fluid intake can lead to thicker blood, making it harder for your heart to pump and increasing the risk of clot formation. Make a conscious effort to drink plenty of water throughout the day. Keep a water bottle handy and sip regularly, even if you don't feel thirsty. Eat heart-smart foods. Your diet plays a pivotal role in vascular health. Incorporate foods rich in omega-3 fatty acids, antioxidants, and fiber. Include salmon, mackerel, and other fatty fish, whole grains like oats and brown rice, a variety of colorful berries, and plenty of leafy green vegetables such as spinach and kale. These foods help reduce inflammation, lower cholesterol, and protect blood vessels. Check your blood pressure regularly. High blood pressure, hypertension, is the single most significant modifiable risk factor for stroke in seniors. Often called the silent killer, it frequently presents without symptoms. Regular monitoring is essential. Invest in a home blood pressure monitor and check your readings at least twice a week. Discuss any elevated readings with your doctor, as managing blood pressure effectively is paramount to stroke prevention. Set a reminder on your phone or ask a family member or caregiver to help you monitor your blood pressure consistently. Proactive management of your health is your best defense. This simple yet powerful daily exercise serves a dual purpose. It keeps your facial muscles and speech coordination active, and it helps you become more attuned to subtle changes that could signal a stroke. It's a fun, easy way to maintain neurological readiness. Once a day, take a moment to practice smiling broadly and saying a short, positive sentence out loud. For example, try, "Every day I grow stronger and healthier," or "My mind is sharp and my body is capable." This practice helps maintain the strength and coordination of your facial muscles and articulatory organs. More importantly, by regularly performing this simple action, you become more aware of your baseline. If you ever notice any difficulty in forming a smile, or if your speech suddenly feels slurred or unusual during this practice, it could be an early warning sign that warrants immediate attention. It's a proactive self-assessment tool that empowers you to detect potential issues sooner. So let's quickly recap these vital, life-saving points. Recognize fast. Remember the acronym: face drooping, arm weakness, speech difficulty, time to call 911. This is your immediate assessment tool. Call for help immediately. Do not hesitate. Every second counts in preserving brain function and improving outcomes. Use your 3-minute trick. While waiting for paramedics, sit upright, perform the gentle hand clench method, and practice deep, slow breathing. These actions can help mitigate damage. Prioritize long-term prevention. Incorporate daily movement, stay well hydrated, eat heart-healthy foods, and regularly monitor your blood pressure. Remember, you possess more power than you might realize in the face of a stroke. Knowing what to do in those critical first few minutes and consistently practicing preventive measures can truly mean the difference between a full recovery and long-term disability. Your awareness is your greatest asset. If this video has provided you with valuable information and empowered you with knowledge, please give it a thumbs up. It helps us reach more seniors and caregivers with these crucial messages. We encourage you to comment below. Would you like us to create a dedicated video on how to lower stroke risk naturally after 60, delving deeper into nutrition and lifestyle? And most importantly, don't forget to subscribe to Everbright Seniors for more life-saving health tips and empowering content every week. Because here, at Everbright Seniors, we believe it's never too late to live ever bright and ever strong. Your health journey is our priority,